patient here was hit in the face with a baseball, and he's going to briefly tell you what happened to him before I examine.
So was playing softball and got hit about right here, and had a concussion, broken facial bones, and caused a air pocket behind my sinuses, and I already had some sinus issues anyway, and so my sinuses have kind of just been problematic ever since.
So have you had anything like headaches or light sensitivity or auditory problems or any other symptoms that maybe go along with that problem?
Yeah, a little bit of auditory problems and some light sensitivity
Okay.
every now and then.
Okay, and how long ago was this
2008
injury?
was the injury.
Okay, so it's been what?
14
years. So what I'm going to do is I'm going to examine his eye movements, and we're going to find the dominant restriction in his eye movements. Once we do that, we're going to use that dominant restricted position in relation to neck movements. And then once we do that, we're going to look at whether the jaw comes into it too. So I want you to follow my instructions, keeping your head perfectly still. I want you to look up towards the ceiling as far as you can with your eyes and tell me what that feels like.
Feels, okay. A little bit of like a flash almost every once in a while.
But no pain, it's
no pain.
You just feel like a flash.
Yeah,
okay.
I think it's from the light.
Okay, relax. Now you're going to look towards the floor as far as you can. What does that feel like?
About the same.
Okay, relax. Take your eyes directly to the right. Now you can see it turned his head a little bit, so this time do it again and keep your head still. What does that feel like?
About the same. Just like I said, every once in a while, a little light sensitivity.
Okay.
Sensitivity.
Relax. Take it to the left as far as you can. Anything there?
It was a little bit harder to look to the
Okay,
left.
so that's the worst one so far, correct?
Yes.
Okay, compare that to the next 4 movements that we do.
Okay.
I want you to do a diagonal up to the right as far as you can. What's that feel like?
About the same as the first 3.
Okay, relax. Diagonal down left as far as you can.
The same thing, a little bit difficulty.
Okay, so the same as the one that we found the most?
Yes.
Okay, diagonal up left. What's that feel like?
It feels okay.
Okay, diagonal down right. What's that feel like?
Feels okay.
Okay, so your dominant position is where?
Good or bad?
The worst.
The worst is to the left.
So directly left over
Directly
this
to
way?
the left, yes.
Okay. Okay, so now what we're going to do is that we're going to take your head back into as far back into its extension as you can and bring your eyes over into that position and tell me whether that increases that restriction.
No, it doesn't increase.
Okay, relax. Now bring your chin to chest and do the same thing, eyes over this way. What's that feel like?
It's about the same as when my head is straight.
Okay, relax. You're going to turn your head to the right as far as you can and take your eyes over into that position. Over here. What's that do to the restriction in the eyes?
It's less than the restriction.
Okay, go the other way. Left rotation, eyes over to the left. Does that increase the restriction in the eyes?
It does not.
Okay, relax. Now you're going to side bend your head to the right.
Okay.
Eyes over. What's that do?
It's a little increased.
Okay, relax. And come this way and eyes over here. What's that do?
It's a little more increased than...
Okay, so that's the most.
Yeah.
Okay, so now the pattern is left lateral movement of the eyes and left side bending. Okay, remember that.
Okay.
Okay, now what you're going to do is you're going to take your head into that position and take your eyes over. Now open your mouth up and see if that increases the strain. Open as wide as you can.
No increase.
Okay, relax. Do it again and clench. Anything there?
Increase.
Increase.
Yes.
So he has a pattern where the eye restriction increases neck restriction and increases jaw restriction in clenching. Okay, now I want you to cross your eyes, and you can see he has absolutely no convergence. And that is commonly seen in people that are concussed. And what that means is that every one of your eye muscles are weak, and they have the inability to work together to cross your eyes. So now I'm going to examine his structure. I mean, it's a little harder to do his examination of structure because of his facial hair, but it looks to me like his right eyebrow's higher than the left. It looks like his right side of his face is a little, well, maybe the left, his one side of his face, it looks like the right is a little fuller than the left. And there also looks to be some asymmetry in the way his eyes are, like his one eye might be a little, the left eye might be a little deeper set than the right. Lean your head back. Let's look at your nostrils. There's not too much asymmetry there. Okay, thank you. For the purpose of this procedure, the first time I do a patient, I have them lay flat on their back with their head still, and they just take their eyes into the restricted eye position. His restricted eye position was directly lateral left. I am using one balloon, and I'm going to do one inflation in all 8 insertions. The insertions are right lower, left lower, right middle, left middle, right upper, left upper, and then I go back down and treat right lower, left lower. And that's to push everything back down. In general, the procedure the first time is uncomfortable, but it's really remarkable the changes that we'll see in him after the procedure. So I take my balloon up to the nostril, I tension it, and I insert it directly down and directly in and slightly down. I switch hands. I make sure that my index finger is by the trigger. I just pinch off the one side of his nostril. He has his eyes over in the position. He takes a breath through his mouth and holds it, and I inflate it once with a good inflation. Okay, what did that feel like?
Just a little pinch.
Did you feel any clicking or popping?
Not a pop, but maybe a click.
Okay. I do the same thing on the left side, directly in and slightly down. Take a breath, eyes over, and that started to move down into the nasopharynx on that one, and that's what I want to happen.
Yeah, I can feel that.
It did not do that on the first insertion. I then take it in, second insertion, which is getting the zygoma directly in, and at a 45-degree angle, you take a breath, and good inflation. That one didn't go down. So he's much tighter on the side that the injury occurred on. I do it on the other side at a 45-degree angle, breath. That one went down. So both lower and middle went down on the left side. The lower insertion gets the maxilla and the palatines, the middle one gets the zygoma. Now I'm going up to do the sphenoid. I take it in, up until it can't go any further, and then back. Take a breath, and that went down. So he's starting to open up. And what did that feel like? You felt some pops?
Felt like a click or a pop.
Good. Same thing on the other side, directly in, up and then back, eyes over, deep breath, and that went down. So he is starting to open up. How did that feel?
Good.
As good as it can, right?
So, yeah.
Now I'm going back down and treating the bottom again. Eyes over, and that went down. And I held it a little bit so that it could move. And we have one more insertion to do. Directly in and slightly down. And that went down too. So the procedure went down in all the insertions, 4 insertions on this side, and it went down in the upper on this side and the lower on this side. So the next time that I would do him, I would do one balloon and do 2 inflations and make sure it goes down in all of the positions. So, so now you're going to stand up and we're going to re-examine him, and we're going to see if the pattern that we saw before is gone. So let's take your eyes over into that position, and I want you to keep your head still. Take your eyes over in that position and tell me if it's still as tight as it was the first time.
No, it's much easier.
Okay, now you're going to side bend your head and take it over and tell me what that feels like.
A little bit easier as well.
Okay, now you're going to do the same thing and you're going to clench and tell me what that feels like.
A little bit easier also.
Okay, so his pattern didn't completely clear up, but it's much better.
Much easier.
So the next time that I treat him, I would use one balloon and I would make sure that it goes down in all the positions. The third time that I would treat him, I would put, if it does go down in all the positions, I would put 2 balloons on and inflate it 3 times. Any questions?
No.
Okay, great.
Awesome. Thank you.
So I did the procedure on him again, and I did 1 balloon, 2 inflations, and it went down into the nasopharynx in all 8 insertions. And now what he's going to do is he is going to, I did 2 inflations. He is going to tell us what it felt like.
So the procedure itself, I wouldn't call it a pinch. It's more of a push, and it's not that bad. Certainly, you're not used to it, but it's once you get the first one, the rest are easy. My sinuses are draining. My nostrils seem open, more open than they have in 30 years. So while it's draining right now, and my eyes are a little watery from my pollen allergies, I think I'm hoping to be able to smell a little bit better again.
Okay, well, thank you for being a subject.
Thank you.
So a month ago, we did the procedure on you. We treated your restricted eye position in lying. We did 1 balloon, 1 inflation. What kind of results did you get from that first procedure?
Almost immediately, like the next day, I noticed, normally my day starts, I feel super congested and I'm clearing my sinuses out and making what are probably horrible noises to everyone around me. And I've noticed I don't do that as much. Usually it's much, it's pronounced at the start of the day, it tails off, and then usually like towards the end of the day, it's almost like tied to me getting tired, I think. Mm-hmm. It picks back up, but I've noticed I haven't had that. I don't do that as much. And I'd say the other thing is even a little bit of, I want to say, I don't know if it's part of the treatment plan, but like part of my smell isn't smelling as
And I have seen that happen with patients.
Because I'm always telling my wife, hey, is this bad?
Mm-hmm.
And I have to have her do a check, and I can actually pick up more smells that I haven't been able to in the past.
Have you noticed any change in hearing or clearness in eyesight? Because that can happen with this procedure too.
I'd probably say not so much the hearing, but maybe the eyesight.
Okay.
It's kind of hard to tell because I need new prescription glasses. But when I take my glasses off, I don't have to hold stuff as close to my face.
I found the same thing with my eyes. My eyesight improved after this procedure, particularly in reading.
And in fact, the bad part about it is I had just gone for an eye exam the week before the procedure. Mm-hmm. And so my progressive prescription at the bottom probably doesn't have to be as high as it is. But I've noticed because the glasses I wear now don't have the progressive correction. They're my spares because my other ones broke. So I notice now when I take them off, the paper doesn't have to be right at my face. It's like at a real reading distance now.
Okay. So let's re-examine you and see if there's any patterns. So keep your head perfectly still. You're going to look up with your eyes and see if, keep your head still. Look up with your eyes and see if there's any tightness in that. Okay, relax. Now you're going to look down as far as you can and see if there's any tightness there.
A little.
Okay, relax. So remember what that felt like.
Okay.
You're going to take your eyes directly over to the right and see if there's any tightness there. Okay, relax. Directly to the left. See if there's any tightness there.
A little, but not as much as now.
Okay, now you're going to do the diagonal upright as far as you can. No, that's left. Go upright, diagonal upright. Anything there?
No.
Diagonal down, left. Anything there?
A little.
but not as much as looking down?
It's hard to say. It's either a little less or about the same.
Okay. Diagonal up left? Anything there?
No.
Diagonal down right? Anything there?
No.
Okay, so the dominant position, you still have a restriction looking down, correct?
Yes.
Okay, let's see you cross your eyes. Is that as good as you can?
I think so.
So he hasn't been doing his strengthening exercises in the last month because he still has weak convergence.
Yes.
So let's take and look at the neck positions in relation to the restricted eye position. So you're going to take your head back as far as you can, look down with your eyes and see if that increases the...
No.
Okay, relax. You're going to flex your head,
Which
chin to chest, look down with your eyes. Anything there?
No.
Relax. You're going to rotate your head to the right, look down with your eyes. Anything there?
No.
Rotate your head left and look down with your eyes. Anything there?
No.
Okay, bring your head to neutral. You're going to side bend your head to the right. Look down with your eyes. Anything there?
No.
Relax. And you're going to side bend your head left and look down with your eyes.
A little, but
Okay,
not as
so
much
he
as
still has that pattern with left side bending and looking down with his eyes. Okay, now take your head to the left and look down with your eyes. Open your jaw up and see if that increases anything.
No.
Okay, now you're going to clench and see if that increases. Look down with your eyes. Clench. Does that increase anything?
A little.
Okay, so he has a jaw component here too. So this next procedure, it's his second time that I'm doing it on him. I'm going to do, the last time I did it go down the throat?
I felt it in my throat.
Yes, but
Probably
it didn't
not.
go in all of
I
them.
don't
So
think
this
it- yeah.
time we're going to do one balloon, 2 inflations. We're going to do the eye position, which is looking down.
I forget which insertion, but I do remember
It
feeling
went
the
down.
pop.
Okay, good.
Okay.
So I'm going to do the procedure on him. I'm using 1 balloon and I'm doing 2 inflations. After I insert it in the first insertion, he's going to look down with his eyes. He's going to take a breath and I'm going to I'm going to just pinch off that one nostril that I'm in and I'm going to do 2 inflations. And that is not in because it popped out. So we have to do it again. So look down with your eyes, take a breath. 1, 2. And that started to move down into the throat. You felt it give, right, Jason?
I did.
Okay, the second one on the left side, take a breath, look down with your eyes. And that one went down into the nasopharynx on the first inflation. So he's opening up. The next position is 45 degrees between the first and second turbinate. Take a deep breath, hold. 1, 2. And that one went down into the nasopharynx. Now we're going to do 45-degree angle on the left nostril. Take a breath, look down with your eyes. 1. And that went down the nostril on the first inflation. So I don't continue to inflate because it already moved down. Then up and back. This one gets the sphenoid. Take a deep breath, hold it, and that went down on the second inflation. So he's opening up, and you can see he's feeling it. Up and back. Take a breath, hold, and that one went down on the first inflation. Then I go back down and treat the lower again, and that pushes everything back down. So take a breath, hold, and that one went down on the second inflation. And then I do the other side. Take a breath, hold, and that went down on the first inflation. So it's interesting. His right side is tighter than the left. Did you actually find that that's the case?
Probably.
Okay,
Yeah.
good. Okay, thank you.
Thank you.
So can you tell me what that felt like and
So this time, I definitely felt it move into my throat, which was, what I was expecting to happen if it was successful. And probably more so than the first time, I feel like wide open right away right now. It was just like almost immediate.
Did you feel any cracking or popping?
No, it wasn't so much of a crack or a pop this time. It was more of just like I could feel things moving.
Okay, good.
Which,
okay, well, let's see if it changed your pattern.
Okay.
So let's, keeping your head perfectly still, I want you to look down with your eyes as far as you can and tell me if that still feels tight.
no, it's definitely different.
It's gone, okay. And I want you to side bend your head to the left and look down with your eyes. What's that feel like?
It's a little slight, but not
Okay,
near what
and
it
let's
was
do the
before.
jaw. You had it open the jaw. How about that?
Improved.
Okay, good. So that was really good.
Yeah.
You know, it definitely opened things up. Okay,
Yes.
thank you.
Oh, thank you.